Hello and good day. My name is Farah Fatihah binti George Lam. I would like to present my poster on my research titled Lupus Anticoagulant LA and its role in female infertility. First, let's go to introduction. Anti-beta-2-glycoprotein 1, anticardiolipin, and lupus anticoagulant antibodies are included in the broad category of autoantibodies known as antiphospholipid antibodies. LA is thought to have the most thrombogenic risk compared to other antiphospholipid antibodies. The inability to conceive and carry a healthy pregnancy is referred as infertility in women. Although antiphospholipid antibodies can cause early gestation miscarriage less than 10 weeks of gestation, it is also a cause of late miscarriage, stillbirth, and other pregnancy complications. However, there are insufficient research conducted to prove that lupus anticoagulant plays a role in female infertility. For the objective, the general objective is to ascertain whether female infertility and lupus anticoagulant antibodies are related. The specific objective is to obtain the demographic data, years of inability to conceive, and numbers of miscarriages in female patients for infertility treatment. Second is to detect the presence of lupus anticoagulant antibody in female patients for infertility treatment. For methodology, this study was done in Hematology Lab, Hospital Sultan Aminah Johor Bahru. From January to June of 2022, a total of 250 patient samples were received for LA tests, which consists of 175 female patients and 75 male patients. Out of 175 female patients, 100 patients were presented with recurrent miscarriage and troubles in conceiving received. From these 100 patients, 20 patients were unable to conceive at all, and the rest 80 patients have experienced 40 miscarriages. LA test results for these patients were recorded, and results during follow-up were recorded for correlations. Data analysis was done using SPSS version 26. The results for this study is, in this study, all patients' result shows presence of LA, which means LA is detected in all patients. However, patients that were unable to get pregnant for more than 5 years of trying and patients with recurrent miscarriage at first and third trimester recorded high percentage of LA detection. Accordingly, patients with high percentage of LA requires more than 12 weeks of treatment. Treatment consists of the combination of low-dose heparin and aspirin, compared to those with low percentage of LA, which only requires minimum of 12 weeks of treatment. As seen in Figure 1, we can see the difference between the duration of treatment according to percentage of LA detection. In this figure, we can see that the highest percentage of LA detection requires more than 40 weeks of treatment, compared to those with low percentage of LA detection that only requires minimum of 12 to 14 weeks of treatment. During treatment, presence of LA is closely monitored until there are no LA detection in patients' plasma. Patients were advised to try to conceive post-treatment, and all successful pregnancy were monitored under intensive obstetric and gynecology care. From 20 patients with inability to conceive, 18 successful pregnancies were recorded. And from 80 patients suffering from recurrent miscarriage, 66 patients are able to carry a pregnancy to full term. As we can see in Table 1, a total of 66 patients recorded with negative LA after treatment, and all of these patients were able to carry a pregnancy to full term. As a conclusion, in this recent study, presence of LA are linked with infertility based on the data analysis. This can be seen in the amount of successful pregnancy in patients after receiving treatment and shows no detection of LA. early detection of LA also lowers the risk of recurrent miscarriage and decreasing the harm to the mother that may be caused by side effect of previous miscarriage. This study will help families to cut costs by figuring out what is the main factor of their inability to conceive a child. This will also save time, and LA screening, personally for me, is important to be included in antenatal screening, since in this study it is seen that LA actually present in patients with inability to conceive and recurrent miscarriage. Also, early detection of LA also lowers the risk of recurrent miscarriage and decreasing the harm to the mother that may be caused by side effect of previous miscarriage. Thank you.